Um, Thank you very much for having me today. My expertise is not in childhood dementia. My expertise is in young onset dementia and older onset dementia. But I would like to share with you today around the work that I've been doing in dementia rehabilitation, because as you know, this is probably quite a new concept in the area of childhood dementia, which would be great to be able to explore a bit more. I'm joining from unceded Darawal lands today in Sydney, New South Wales. And I'd also like to pay my respects to elders past and present and extend that respect to any Aboriginal and Torres Strait Islander people who might be joining with us today. So, first of all, I'd like to say there's different terminology that you might see about these approaches. This is an example of just a couple of Australian groups that have used either rehabilitation or reablement to talk about this concept. And the reason is that there's no official consensus yet as to which term should be used to describe these approaches. Internationally, there does seem to be a trend towards dementia rehabilitation. So I do think that's probably where we will end up. But in Australia, the government continues to use reablement, and that's what the funding is linked to. That's what they say in the National Dementia Action Plan. So that's why sometimes the different terms get used interchangeably. And certainly the work that when we originally started doing this work, we were using the term reablement before rehabilitation had become more popular. So yeah, I will use them interchangeably, but they are essentially describing two very similar concepts. So, what is reablement or rehabilitation in the context of dementia? It's about maintaining function for as long as possible, regaining lost function where possible, and building on preserved strengths and skills, and adapting or compensating for functional changes as much as possible as they occur. So, people with dementia have identified they've got a wide range of needs and they want access to reablement interventions. And people impacted by childhood dementia have identified common areas of need as well, all of which could be supported through holistic dementia rehabilitation. But in Australia, services for people with dementia are often quite fragmented, difficult to access. There's limited services where allied health professionals feel confident in providing a dementia rehab or reablement approach. And that makes it difficult for people with dementia to access post-diagnostic support. So the National Dementia Action Plan and the Clinical Practice Guidelines of People with Dementia, which are currently being updated, so hopefully we'll be able to see the new guidelines in the not too distant future. But I know that they will also recommend that people with dementia should be having access to dementia rehabilitation or reablement. So what's it all about? Well, the World Alzheimer's Report that came out in 2025 was dedicated to dementia rehab. So it provides a really nice overview about what it's all about. Basically, it's person-centered and individualized. So it should be really focused on what matters most to the person and tailored to their personal goals, their values, and their abilities. It should be goal-oriented with function-focused goals. So specific, meaningful, everyday goals around things like self-care or communication or mobility, whatever the person's priorities are. It should be strengths-based and capability-focused. So there should be a real emphasis on maintaining abilities for as long as possible and building on preserved skills and habits rather than focusing on decline. It should be collaborative. So the person with dementia, the family, and the support team around all working together towards achieving the goals and working on the program. And it should be interdisciplinary and holistic. So it should be really thinking about integrating cognitive, physical, environmental, social, emotional factors all together. So the core components are thinking about comprehensive holistic assessment. So that should be around the person, their environment, their family, and thinking about the strengths and challenges and priorities for the rehab program. Should involve collaborative goal setting. So to develop really personally meaningful SMART goals that are anchored in everyday life. So for example, independently making breakfast every morning. It should be individualized and a program should be developed based on the outcomes of the first two things. So the goal setting and the assessment. And so that should be really tailored to the person in terms of their strengths and their abilities and their priorities, the context and the supports they have around them. And then monitoring and review is really important as well to make sure that the goals are being revisited. Have they been achieved? Should new goals be set? Do they need to be adjusted if things have changed? So dementia rehab should really take a holistic and interdisciplinary approach rather than focusing on sole allied health disciplines, just working alone. So within this model, the disciplines have really complementary roles in terms of addressing really holistic functional goals. So a couple of really important roles to highlight, I think, are allied health assistants and care support workers who can really greatly enhance sustainability of implementation of these programs by reinforcing rehab strategies in between visits and within daily routines, and also family carers who have a critical role in supporting the person with dementia to participate maximally during the program. So not just as recipients of education, but as co-therapists to learn strategies to apply them throughout the person's day in between allied health visits, but also to support family in parallel with the person with dementia is super important as well. So the World Health Organization in 2023 recommended that dementia reablement or rehabilitation should be provided for people with dementia and outlined a range of evidence-informed approaches for that. The Lancet Standing Commission, the World Alzheimer's Report, and the Australian government are all recommending that people with dementia should be having this approach. And there's practical resources to support this happening in practice as well. So I was involved in development of these freely available resources, which were designed to support allied health practitioners to design, deliver, and evaluate evidence-informed reablement programs for people living with dementia. And these were developed in collaboration with people living with dementia and family carers, allied health practitioners, managers, policymakers, and academics as well. The original resource was released in 2018 with an update in 2019, and the evaluation guide was subsequently released in 2021. And they all have been freely available the whole time and continue to be freely available. But unfortunately, an evidence to practice gap still remains for people living with dementia. So we've got evidence to support the approach. We've got practical resources to support it happening in practice. We've got policy saying that it should be happening, but people living with dementia are still not routinely offered dementia rehabilitation. So there's a really important implementation gap that's happening there that we need to understand and work out how to overcome. So more recently, I've been working on a body of work that's specifically trying to understand that implementation gap. And that's involved a series of activities that have all fed progressively into each other to try and understand this and work out how we can overcome it within the Australian context. If anyone's interested, we published the protocol of this body of work. So it's all written down in one place in terms of what we have planned to do and what we have done. So the first activity we did was a clinical audit. And the reason we did that was because we wanted to understand what's happening in current practice when people with dementia are referred for allied health support in the community. That's being published as well. That one's open access, so it should be easy for anyone to download if they're interested. We recruited 4 community aged care providers who provided us with data from 20 people with dementia who'd recently completed an allied health program. We compared what they had received in terms of their interventions against the recommendations from the handbook, and then we fed back what we found to the allied health teams in a series of focus groups. And the purpose of doing that was really to ask allied health practitioners who are working in real-world practice what's possible and what the barriers are to doing evidence-informed practice. What are some potential enablers to support it happening, and what are some potential practice change targets? This is an example of the audit outcomes. So we use a bit of a traffic light system because I like visuals. I'm an OT, I can't help it. So the green areas were where there was good handbook alignment from the practice that was happening, the yellow areas where there was some handbook alignment, and the red where there was less handbook alignment in terms of the practice that was happening for the people with dementia. This is just an example from the OT program. We did a similar one for the physical exercise, physiotherapy and exercise physiology program approach. That's in the paper if you want to. I'm not going to go through it, but it's if you can download the paper if you're interested to read it in more detail. So that was quite small. It was a clinical audit with 4 community aged care providers. Obviously, now that's not representative. So what we did next was we did an international scoping review to look internationally across the literature, what the barriers and enablers are to implementing evidence-informed dementia rehabilitation, and also to identify implementation strategies to support the approach happening. That should be open access, and we've signed the forms to make it open access, but it's today still looks like it's behind a paywall, but it won't be soon. Hopefully it will be open access very soon. So we use the outcomes from the clinical audit and the scoping review to inform the next activity, which was a national Delphi survey. So bringing it back to the Australian context, now we did want to look more broadly across Australia to try and gain consensus around broadly across Australia what those barriers and enablers are to implementing dementia rehab or reablement. That one is open access. If anyone's interested in reading that in detail, you can access it there. And of course, I can share links to all this stuff afterwards if that's useful. The Delphi survey was 2 rounds. So the first round was to try and gain broader national consensus around what those barriers and enablers are to implementing dementia rehabilitation. And then the second round was about saying, okay, well, now we know what those barriers and enablers are. What are some implementation strategies that could be important and feasible to address those identified barriers and enablers? So we had representation across every state and territory in Australia, except for the Northern Territory for this activity. And we had representation across metro, regional and rural areas and from a range of stakeholder groups, including people living with dementia, family members, allied health practitioners, academics, program managers, dementia consultants. The allied health practitioners were the biggest group within that. And so I just did this little pop out to show that there were a range of disciplines that were represented within that. So we use a consolidated framework of implementation research to prepare the Delphi and to analyse the outcomes as well. So round 1, the barriers and enablers were broken up into the system level, the service provider level, thinking about the family level and the person with dementia level. So a range of barriers reached consensus across these domains. So in the system, an example was having not enough knowledge amongst the community and amongst the professionals who are working with people living with dementia about dementia rehab and how important it is. And so then it's not getting sort of recommended or people aren't asking for it either. So we need more knowledge about this approach. At the service level, it was about service providers not offering dementia rehab to their clients with dementia or cognitive decline when they come into the service. For families, the barrier was around families feeling overwhelmed and not able to support the person with dementia to participate in the program. And for people with dementia, it was when they lived alone or didn't have family support. Encouragingly, more enablers reached consensus than did barriers. And that's a really positive thing because these are the factors that could be leveraged and built upon to try and make this happen in practice. So across those same domains, an example of a system level enabler that reached consensus around having policy support where dementia rehab is an expectation rather than something that's just nice to have. For the service provider level, it's about having multidisciplinary teams that are really collaborative with good communication, with support from leadership and promoting reablement to clients when they come into the service. For families, an enabler was understanding the abilities of the person with dementia so they can support the person to keep doing what they're able to do for as long as possible. And for the person with dementia, the onus of the enablers was actually on the team, the allied health and care team, to make sure that they ensured they had developed a really strong rapport with the person with dementia to support them to participate in the program. So then moving on to round 2, we use the ERIC recommendations for implementing change, or the ERIC expert recommendations, or the ERIC strategies list to propose a set of implementation strategies. And then through the survey, 4 domains of strategies reached consensus. The first one was around education for service providers, education in terms of both dementia and reablement or dementia rehabilitation. And these are a couple of examples of freely accessible options or online courses for people to access to be able to upskill in those areas. The second area was around reablement implementation planning. So making sure that service providers understand there is adaptability in terms of how reablement is delivered to fit within each service context, because each service is different. It's not necessarily going to look the same for every service in terms of how they're able to roll it out, depending on what resources they have available. making sure that leadership's supportive and that people are promoting reablement to clients when they come into the service. Quite a number of practical considerations of reablement, of delivering reablement, reached consensus, but examples were where families involved making sure that they're supported in parallel with the reablement program and making sure that people with dementia are supported to participate in the program. And then the final area was around broader strategies. So thinking outside the service level context, the service provider context, thinking about the people making referrals, the GPs and the diagnosticians, making sure that they have a knowledge and understanding around the importance of dementia rehabilitation. So it's getting introduced early, making sure people have an understanding around the funding mechanisms to leverage to support people with dementia to access these services, and making sure that allied health practitioners in general are upskilled and are confident in understanding dementia rehab and working with people living with dementia. So through all this work, we've developed an implementation guide, and the guide is designed to support community allied health teams to be able to self-identify what their strengths are and also identify opportunities for perhaps selecting some implementation strategies for them to upskill and prepare to roll out dementia rehabilitation interventions within their service. So it's currently in a beta version and we're piloting it now in the next phase of the research. And so we're working with some community allied health teams who are using the implementation guide, and we're using the reablement handbook as the example intervention approach for them to use with that implementation guide. That's it. I'd just really like to acknowledge that we have a project advisory group for this body of work, and their contribution has been really invaluable. And also, without all those participants and stakeholders participating, contributing to each phase of this work, none of it would have been possible. So it's a really sort of collaborative approach that we're taking. And of course, to acknowledge the other researchers on the team.